Hello, everyone, and welcome to HealthPod Africa, where we have inspiring conversations on healthcare in Africa and related topics, with the aim being to inspire action towards patient-centered care, as well as improving access to affordable and quality care, while at the same time focusing on resilient and sustainable health systems. Now, in today's episode, we are kicking off the discussion with an interesting conversation about rare disorders in Kenya. We will talk about how it is living with a rare condition, how this affects families, the challenges faced by families, as well as the support systems that are available with respect to rare disorders in Kenya. Now, today I am joined by two lovely ladies who are the founders of Rare Disorders Kenya, Roselyn and Christine, and I will just allow them to introduce themselves.
Hi, my name is Roselyn, Kanja Odero, and I'm a mother to a child with a rare disease.
Thank you, Cynthia. My name is Christine Mutena, and I'm a mother to two kids with different rare conditions. The first one has a chromosomal anomaly called ring 18 chromosome. The other one has a gene mutation called, it's a mouthful, megalencephaly capillary malformation, which is like a different symptoms brought together to form a syndrome.
Thank you very much, Roselyn and Christine. If you watched my first episode, I mentioned that I had a son who had a rare condition, and this is how I met these two lovely ladies almost 7 years ago. Now, Roselyn, maybe you can tell us your rare journey, and then we'll move on to you, Christine, to tell us your rare journey before we move on to how you founded Rare Disorders Kenya. So, Roselyn?
Okay, so my journey started somewhere about 8th or so month of my second-born's pregnancy. And then they noticed that the child has cysts in the kidneys. And the doctor said, sometimes we pick these things up early, but they disappear, or rather they resolve themselves by the time the child is born. So we kind of knew there was an issue with the cysts, but everything else was okay. Until now, when I was supposed to go in for my almost towards the last, around 9th month around there, I was supposed to have the final checkup before now getting ready for the birth. And my doctor wasn't there, so I was referred to another doctor. And that doctor was a bit more thorough and sent us for a scan because of this cyst issue. Oh, and I'd earlier had also placenta previa, where your placenta attaches nearer to the cervix, which can be an issue when giving birth. So when they checked, that's when I could see it was taking long. And he kept saying, something I'm not seeing. The baby keeps moving. It's something I'm not seeing. So it took 1 hour and I was told to come again. So by then I could tell something is off. So when we came the next day, then he said, I need to talk to your doctor. And then I was like, just tell it to me. So he's saying, the baby is missing a part in the brain. And we kind of need to monitor that. So by the time I went back to my doctor, says, this is it. But I think right now we'll need to treat it as now that you're at risk and all that. We need to get all the doctors ready by the time you get born. So they didn't know what we're dealing with. So we were given Dandy-Walker variant at that time, which was in itself at the time when you're Googling, you just don't, there was not enough. The Google has 1, 2, 3, 4, the Google, the 0, 0, 1, 2, 3.
Yes.
I think they were going up to 3.
And what is Dandy-Walker? You've mentioned Dandy-Walker variant. What is
so
Dandy-Walker?
Dandy-Walker is it's also a malformation of the brainstem.
Okay.
It's still in the same group of diseases called ciliopathies, like what now we finally got a final diagnosis of Joubert syndrome much later. Okay. But they're in the same group. So it's a malformation of the brainstem, and then there's a lot of issues with balance and coordination. So by the time we gave birth, and the doctors were, at this point just checking what's going on and just monitoring. So far, he scored well. A bit of what is called hypotonia, where the limbs or the body or the muscles are a bit more limp than usual. So we're told it's just at this point it's a wait and see. And of course, we still had the issue of the cysts and the kidney. And by that time, they could tell one kidney is not working. So, but the other one had picked up function and they're okay. So unfortunately, the first 1 month of his life was just chaotic. So yes, we had what we knew was an issue at the time, but then we ended up having severe jaundice that necessitated us to go into ICU and have what is called a blood exchange. They remove part of the baby's blood and they inject another blood. That was as a result of something called ABO incompatibility, meaning I'm O positive, my husband is B positive, and somehow that doesn't work sometimes. And children tend to get jaundice and it can get quite severe. My first one also had it, but we didn't know it was really an issue. So that for the first 1 month was really a big issue. Then he went on again to develop something called NEC, necrotizing enterocolitis, which is really a serious disease for the gut, can kill off the gut, and most preemie babies have. So
and
we were dealing with that.
You still didn't have a diagnosis.
We still didn't have.
Dealing with the other.
We had the other one, but you see now that was put on the back burner because it was no longer an issue. That was not even an issue. The issue was these two conditions, but we survived that. It was really hard for us because for the first 3 weeks we were ICU, HDU, and you don't know what's happening. Yeah. And of course you have the bills, and by then the insurance, there's that gap that they have. So your baby can be put into insurance, I believe, after they've left the hospital. So mine had not left the hospital and they can only cover 100K.
So during that period, he's not covered.
He's not covered.
He's under maternity, but up to 100K.
Yeah.
By the time we're leaving, we had 1 million plus on top of everything else. If you remove NHIF, you remove everything. So of course there was a financial stress that was coming up, yet you had cover, a good cover. So, and that's one of the challenges that you find later on with rare diseases. So moving on, life settled, but you also had challenges. He was not thriving. So after a while, we figured out mommy here doesn't have enough milk. So once we sorted that, he started thriving. But then the doctor still was like, something is off.
At this point, how old is he?
4 months.
Okay.
At 4 months, but still he was not gaining well. But also there was that the doctor said, let's do a brain MRI. And when we did the brain MRI, that's when now we got the final diagnosis, Joubert syndrome. Joubert syndrome is a genetic neurological condition where the brain is malformed in a very specific way. It misses a part called the vermis, cerebellar vermis, which handles your balance and coordination. Like the fact that you're seated, if someone pushes you, you can kind of tell your balance back beyond even your ears that do the work for balance. And so with my son, walking is a challenge because it's hard for him to be able to tell his surrounding, his space in terms of balance, even as his body. Even walking, coordination of his body movements, like I want to touch my nose, I might pass and touch my ear. So that's called ataxia.
How old is he now?
Now he's 8. He's turning 8 next week. Oh no, this Saturday. This Saturday. He's turning 8. Yay. Yeah, we're very excited about that.
And how old was he when you got the diagnosis?
4 months.
Okay, which is pretty fast for a rare condition, right?
I would say we were very lucky. The fact that this radiologist saw something wrong in the brain set off the chain reaction for us to get to. Otherwise, we would have been probably told cerebral palsy, which is common,
Yes.
And the fact that they even doing the brain MRI here in Kenya, getting Joubert syndrome, that was very unique.
Did you use a specialist, or how did the doctors know to look for Joubert?
I think it was the radiologist. And what I've seen now, what they do, and we really are excited about, is that they connect with others around the world.
Mhm.
So if they see a challenging case, they have other network of
Or
doctors.
the radiologists.
Yes.
Okay.
And other specialists too. And so that helps for people living with rare disease. And I've seen it also in other cases. So for this one, even in the Western countries, we've had cases where people have gone several times, done MRIs even 4 or 5 times and never get it. So we were very lucky. So at least
Yeah,
we
that's
had a
amazing.
diagnosis, and that's a huge thing for a person living with a rare disease.
Yeah. Well, thank you for sharing your story. Happy birthday to your son in advance.
You want the birthday party?
Yes, we want to be invited to the party.
Yes.
Now, maybe I'll invite you, Christine, to tell us about your rare journey. And then as you cover that, maybe you can also tell me how you met Roselyn and how you founded Rare Disorders Kenya.
Okay. That's going to take like 2 hours, but I'll shorten it.
Please do.
Because I have 2 kids with different rare conditions. So my firstborn, who is turning 18 in January, has...
You have a whole adult.
Yes.
Wow. Congratulations.
Thank you. She's on with the gene mutation, the one I'm calling MCM in short, megalocephalic capillary malformation. And she was half diagnosed at birth. One of the symptoms to form the syndrome was, some of it was diagnosed at birth. But up to now, we don't have like a stamped approval. It is MCM, but it's highly suspected to be because she fits all the different symptoms and conditions that form that syndrome for MCM. And he had to have brain surgery at 3 months. I think that has been my hardest hurdle in my parenting for both kids.
The surgery.
The brain surgery. Because that was my first time I'm actually making a decision for somebody who is not myself.
And you're a first-time mom.
And I'm a first-time mom. I was very young. And it was too much for me. But I always say that firstborn prepared me for secondborn, because secondborn had a whole myriad of issues. So when she was born, I had a very good gynecologist who told me, we shall monitor the second one. So don't worry. Yes, I think this is de novo. De novo means it's sporadic. It can't happen again. It's just by chance. And he made a lot of sense. So I said, you can try again.
Did you do any genetic testing or before you had your secondborn, or?
There were none in Kenya, and they're so expensive.
Okay.
I believe the mothers of today who have 10-year-olds, 8-year-olds have it way better, because such things were not even like a simple karyotype, which is checking the chromosomes of a individual.
Was not available back then.
No, it had to be shipped to India. So anyway, so backtrack to my doctor telling me, no, you'll be fine. Don't worry. We'll monitor your scan. I think I had a scan every month. Usually people have like 3. We had like every month. And for sure, everything was good. Now that's for the second one. Till when I gave birth to her, I'm told the pediatrician was reading a magazine just waiting to do her work. And
she assumed it was a normal delivery.
It was a normal. It was actually an elective surgery, because I couldn't get to 40 weeks because I am rhesus negative. Okay. So my doctor was like, it's best to do it at 38 weeks plus other issues. So it was an elective surgery. So by the time she's reading her magazine, we're talking to the doctors, waiting to see how things are going to go. We found it was an emergency in the sense that she had swallowed meconium and inhaled it. And it was an emergency. So she went straight to ICU for like 5 days, HDU for like another 5 days. Because I remember we left the hospital at 2 weeks of age. Okay, I was a bit thankful because I didn't have to clean the umbilical cord. But that apart, everything else was scary. But so as they grew up, we realized they have different. She's not hitting the milestones.
So at what point do you realize something's not right?
For the second one?
Yes.
I didn't know. I wouldn't lie to you because I didn't know what the milestones are, because my firstborn did not meet any milestones. So she was late to walk, late to talk, late to sit, all that. We even had started physiotherapy. But now with the secondborn, a friend of mine had come to visit around 6 months old. And she told me, where isn't your baby sitting? I'm like, I don't know. So we took her to the doctors, and the doctor said, yeah, she has delayed development. So we started physiotherapy again. And when she was around 2 years, I remember the physio then it was an OT. The occupational therapist called me and told me, I think your child has Down syndrome.
Okay.
I was in the office and there was a photo of her on my desk. I actually went to Dear Google, features of Down syndrome. And I'm like, so I was like this, between the photo and my laptop. And I'm like, no. But see, I can't be too adamant and say no because my firstborn had an issue.
Mm-hmm.
So with that, I took her to a lab where they had to draw blood and send it to India because there was none in Kenya for genetic testing. We didn't even have a geneticist, nothing.
Mm-hmm.
And I remember they sent me the results.
Directly to you?
Directly to me.
Not
and
to
at
your
the
doctor.
bottom, maybe they sent to him as well, but I
Okay.
got a copy. And at the bottom of that test results, thank you, patient advised to see a genetic counselor. That's one of the things might not be so good because nobody, but you go to the summary. So they had said I need to see a genetic counselor, and I was like, what? So I started googling, and I'm like,
Which year was this?
2013.
And they were?
Were there any genetic?
The first one was 2013, 7 plus 3, 6. The first one was 6.
Okay.
Second one was 2.
2.
Yeah. So it's the second one that now we're told. And I think that's when I dipped, to be honest, because that's a long time thing. When you can have delayed developments, but you still pick up.
Yeah.
That's when I knew this is actually a lifetime.
Yeah. How was
thing.
the social support around you this time?
Apart from family, there was nothing. There was no. I didn't know for some reason. I didn't know any. I told you I got kids when I was young, so my circle of friends had kids my age.
Okay.
No, my kids' age. Sorry, and I didn't know any family with a child with a disability. Then certainly I didn't know what milestones are and everything, but as we were trying to get support, apart from my immediate family from both sides, everyone else could just tell you, I'm sorry, but no, how else can they support you? And I remember I started a different support group just to bring in different parents together, just to talk. Because I honestly felt left out. Because as Roselyn said, it's a cerebral palsy, or it was autism or Down syndrome, but I did not feel I belonged there. Because I couldn't share about geneticists are planning going to see a geneticist for family planning. They'll ask me, there was no correlation. And as I talk, I've skipped a lot of in and out of hospitals for the second one because it was too much to count. But as time grew, I realized I was not the only one because rare diseases are rare, but together they're common. Yeah. So I got my support group online from Facebook. And
was this support group, where was it based?
US.
Okay.
It still is based in US.
Okay.
But I have had so much connection with them. I've gotten to learn, like for my firstborn, what to look for. Because we had to do ultrasounds when she was young every 6 months because of the kidney tumors. But luckily she never got. So at least those are things I used to learn and take them. I used to have a file, take them to the doctors. I'm like, these are what they're saying. Can we do this? I was like, okay, still am. But I felt like I was their researcher. I was their primary doctor. I just couldn't execute what I think needed to be done for them.
So from what I'm hearing you say, your experience as someone who's living with a patient with a rare condition, the information you provide to your doctor is very relevant in the course of care or course of treatment that they decide upon together with you, obviously. So at what point do you then, so now you're in this support group, which is based out of the US. At what point do you decide to found one here in Kenya?
I remember I was, again, okay, I hope that office doesn't hear this. I was in my office again and I was researching about rare diseases. Then I came across Rare Disease Day. This was in January and Rare Disease Day.
And what is Rare Disease Day?
Yeah. I'm getting there.
Okay.
So as I was researching for rare disease, I came across an event called Rare Disease Day, which is a day of creating awareness around rare diseases in the world.
Yeah.
And that when I was doing that research, I was a bit almost going to early mid-January, and I found out that Rare Disease Day is held every last day of the month of February, without fail. So I'm like, why can't I do this? So I actually remember writing a concept paper saying my kids have this, sending it to different, can we have an audience? Can we do something? And one of the mainstream medias then told us, sure, come and talk about your journey, because I met another lady and together now we started doing this more. She joined me online.
Okay.
And I think
so at that time it was just the two of you?
It was just the two of us.
Okay.
And we met the day we were going to the studio.
You had been communicating
online.
Okay.
And I think whoever discovered online needs to go to heaven. That said,
because it really connects people.
It really does, especially in this rare disease journey. Because even Roselyn, she found my story online, I think. Then she called me. So that's how we met, as in...
And what year was this when you met?
2017.
2017, yes.
Okay.
2017.
Yeah.
So that's just a year before I met you both. I think I met you.
No, you met me first.
I met you in 2018 though.
Yeah.
Yeah, so okay.
So I've been alone between 2007 to 2017. But we've been doing rare disease on and off.
That's a whole 10 years before forming this community
of
Rare Disorders Kenya. So now maybe we can move on to tell me about Rare Disorders Kenya. What do you do at Rare Disorders Kenya? What's your mission?
Okay. You want to take it out?
I've spoken too much.
Okay. So, hearing from our journeys where we've come from, so we decided, let's do something beyond the yearly event.
A year thing.
So we met, so we, like for Rare Disorders Kenya, like now after we met Christine, we did 2018, though Christine was doing it before. So 2018, then you have, you're at the peak, you have fun. Then the whole year ends, come back next year, like that. Then at some point, somewhere around, I think 2019, 2020, then we started figuring, why don't we make this a bit more formal and do more beyond just the yearly big event and disappear.
Yeah.
And what actually led us to form an actual organization or an actual strong support group is the fact that these stories, yes, everybody has different rare conditions, but the challenges are the same. The challenges of trying to get a diagnosis, like you see, like we got one and then found out there. For us, it was a bit, the span was short. But for others, you live with a condition for so many years being told it's this or that, or you're living literally like in the shadows. People don't understand, or they just think that either you're making it up, especially when it's invisible. And so those challenges are multiplied. It's the same thing. People having a challenge getting a diagnosis, or not enough specialists, or specialists not being able to pinpoint what's going on. Or it's a financial strain because these diseases need care and management, which we don't have treatment, yes. Rather, we don't have a cure, but just managing them is just so costly.
It is.
And so out of that, Rare Disorders Kenya was born. And that's the journey that started that connecting people, first of all. Like, when someone comes in and says, oh yeah, my child has this condition. And then they find out there's a whole community. It might not be the same condition, but just knowing there's someone else who understands, you just need to say this and everybody just gets what you're dealing with, than having to try and explain that to someone who doesn't.
Actually, when I met you guys in 2018, just after I'd lost my son, I think it's the first time I felt understood. Although I met you after I had lost my son, I didn't know people living with rare conditions. I didn't know anyone living with a rare condition. I didn't know people with children with rare conditions. So up to that point, I had felt very alone.
Yes.
So when I joined Rare Disorders Kenya, I felt like it was a community that got me, even though my baby only died at 6 months of age. I just felt connected to the group, even though I am no longer a mother to a child with a rare condition because he passed away. But I still feel very connected to Rare Disorders Kenya and the advocacy towards creating awareness, because it really does save lives.
It does.
So maybe moving on, I can ask, what kind of support does Rare disorders provide
Mhm.
to patients and their families, and what advocacy efforts are you involved in to make sure that patients and families of people affected by rare conditions are taken care of by the system, be it in terms of, you've talked about financing, the insurance aspect. How does that look like for someone with a rare condition? When it comes to engaging with the medical fraternity, what would you advise a patient or a caregiver for someone with a rare condition? How do you approach, because the condition is rare, your medical support provider has probably not come across it.
True.
How then do you engage with them to make sure that they are providing you with the care that you need or that your child needs?
Okay. There's so many questions in there.
I'll
try and remember all of them.
I think this, okay.
Yes. Okay, so let me start, and Christine, maybe you can talk about
chime in.
advocacy
Okay.
and some of the things that we do. So what kind of support do we give people living with rare diseases? So we've talked about rare diseases being a challenge in themselves. There's the issue of the financial strain, and just understanding that rare diseases are not only a health issue, because they affect other things. You find that women most of the times are left with the burden of care for these patients, because it could be your sister, or it could be your mother, or it could be, so women tend to either be the ones who, if you're married or you have a partner, you let go of your job so that you can take care of your child.
Yeah.
So that's a loss of income. Then also, when it comes to even the society, you find that most of the times, because maybe especially where conditions are not quite obvious, people tend to think, this one is just making them up. Oh, they're just looking for attention.
Or
So there's that
somebody else's
stigma
child
that comes
started
here.
like that. So.
Yes. So that means even if you still have a job, it means most of the times you have to be away to take either your child to the doctor, or they're unwell, or there's a flare, you have to take. So it affects a lot beyond just health.
In your situation, did you need to make adjustments in terms of your work?
Yes.
Okay.
So I'm lucky that I run my own business, but even then, it meant that I had to move home, because I'm filling the shoes of a nurse, a physiotherapist, a mother, and a teacher at the same time. And my husband goes to work. But I had to do that. I had to scale down so that I can be there for my children. My second born has also challenges, but most of the health issues were with my second. So you can't just be away and hope, unless you're going to hire a nurse. And of course, that's another cost.
Yeah.
And so at the backdrop of all this, how do we help our community? One, the support element. That cannot be understated.
Yeah.
Because like you're saying, the feelings of isolation and loneliness, or knowing that someone else is going through this, kind of cuts your problem half. It might not pay your bills, but someone else is going and understands what you're dealing with. And so we connect. We have one of the, I think, the largest support group for diverse rare diseases in the country. And it's growing every day. Right now, we've mapped about 105 rare diseases. Okay, we have 7,000 to go. So
105 currently. Okay, what I'm hearing you say is that the membership of Rare Disorders Kenya has 105
distinct
different
rare
conditions.
diseases.
Yes.
However, the families, some conditions are overrepresented, and some conditions have their own community, which is fine, and we really encourage that.
Yeah.
Let's say, for example, if let's say muscular dystrophy, they have their own organization, they have their own community, which is fine. They have more members because we're having a lot of cases like that. However, so that's the support, connecting people to each other and ensuring there's a place that people can connect. Yeah. Beyond that is collaborating with others, and collaborating that's important with different stakeholders in the country, abroad, in the region. That means that we can be able to benchmark with others. We can be able to, currently Rare Disorders Kenya is one of the founding members for what we call ARDA, Africa Rare Disease Alliance. I always want to say associations. We're pretty new.
So you've now created an Africa-wide alliance.
Exactly. Yes. And how that helps, it means those who are starting, we can give them a hand up. And there are those who are ahead, we can be able to learn from them.
And which are the countries represented in this Africa Alliance?
So at the moment, we have Botswana, We have Ghana. We have South Africa. Tanzania just joined. Lesotho. We have
Guinea-Bissau.
Guinea-Bissau. Rwanda. Yes. So Africa is lighting up.
Yeah.
Currently, it was a bit more dark
It's
than
definitely
this.
progress.
It is a whole lot of
Yeah.
progress.
It is. And so that collaborating means we are able to pull each other up. Because when you look at rare diseases in like Europe, they're far ahead. They have their own association. It's a whole other ball game. So that's collaborating. Collaborating means that even we can get into spaces where people are ahead, and we can be able to bring in expertise that is lacking here to speak on certain issues where we need them, even locally. And then we look at the next thing is also research. So currently there is no known research for rare diseases in the country. Like, how many are there? How many people are living with this rare
But the data
diseases?
you currently have, isn't it like useful in terms of coming up with that research? Because if you already have 105 different conditions, it's a starting point.
It is.
Yeah.
It is.
But we need more in-depth research, like
Yes.
what is our national definition of a rare disease? Because see, we cannot be the same as, for example, Canada. Because so we have to, it needs a lot of resources to actually just get that definition, not even necessarily definition, but how can we say this is what we define as, and not follow the WHO definition?
So right now, there is an operational framework, meaning that they are coming up with a definition that countries can use. Because the thing is, a disease can be rare in one country and not so rare in another. For example, sickle cell in this region, it's a bit more prevalent than you have sickle cell in, let's say, where? Iceland or somewhere like that. So
for them, it would be rare, but here it's not.
It's not. You
rare.
cannot say it's rare, though it's considered rare mostly in other parts in Europe and the like. And so research is important because it can inform government in terms of what resources to put aside or what can they do to help this community. And so one of the statistics that we use is what is called Global Point Prevalence Index, where we are able to tell given the global statistics, this is how many people are living in Kenya. And by mapping that, we're looking at 2 to 3 million. That's a huge number.
Yeah.
And this community, and that's, most of the time, these statistics are on the lower side. And so that's a huge number to just not consider or cater for. And so research is important. Research means that we can, again, know where this, even just finding out the inheritance patterns. So sometimes, like, some conditions are being found in certain regions in the country. Do we need to know why?
Yeah.
That's important. And then finally,
Improving the lives
of, and that's where the support comes in.
Yeah.
So I've forgotten one. We
have
have 4 objectives.
Yes, we have. Improving lives, there's
research,
collaboration,
awareness. How
advocacy.
can I forget about awareness? And that's where she comes in, and it's just telling people that, do you know that rare diseases, and that's where Rare Disease Day is very important for us, because it's an opportunity to just tell people about rare diseases and just start that conversation. And even when we approached the ministry at the time, way back in 2018,
that's the Ministry of Health.
The Ministry of Health and the then CS. And they didn't know what we were talking about.
Is that a neglected tropical disease? We're like, So you felt like we're schooling them, these 3 mothers who are...
Yes.
No, it's amazing that you've also approached government to try and sensitize them on rare diseases. And maybe this will bring me to my next question, that I'm aware that you're members of the technical working group on rare diseases at the Ministry of Health.
Yes.
Yeah. And I think it's a great milestone that we even have such a technical working group.
Yes.
And I'm guessing you guys had something to do with it, because when you approached the ministry, they were not aware of rare conditions. So your awareness is actually informing policy already, right?
True.
Your advocacy is already informing policy. Now, my question will be, what is the function of this technical working group, and what are your views on that moving forward?
Yeah, we are the part of the TWG for the technical working
TWG is
technical working group. I realize, yes, the technical working group TWG for rare disorders in the country through the Ministry of Health, and we are the secretariat.
Oh, really? I didn't know that. You're the secretariat.
Yeah. So having the TWG formed was a huge milestone, because at least it shows that the Ministry of Health is acknowledging that there are rare diseases in the country, acknowledging that there is something we need to do, whether it's policy making, whether it's figuring out how to handle the database for people living with the rare diseases in the country. It is a step. And we took that with a whole lot of gratitude, because it shows our advocacy has not been in vain. And as I said, that was under our awareness objective, and collaborating also with different stakeholders, because at least that is a huge milestone that you cannot not talk about.
So what does a technical working group for rare diseases do at that level at the government, at the Ministry of Health?
We have different representation from different organizations, and some also rare disease groups, like what Roselyn was saying, there's some sub groups, if I can call them that. Then we have the RDK at the top, and we talk about what is needed for our members, the community, and what each stakeholder can do. How can we start research? How can we do a policy around it? How can we bring in different stakeholders to actually make it purposeful for the community, so that we can, we can tell the Ministry of Health, this is what is needed under this domain.
And just to add, and it's just to inform policies that will affect rare conditions. And though we must add that it's not only rare, but also genetic conditions, because those have not been represented in the ministry per se. And so it informs the government in terms of even the policies they'll need to have. Like when they need to do something, we are called upon to become that voice to the government.
And then for the first time this year, 2024, MOH actually had a Rare Disease Day campaign.
Amazing. For the first time ever?
Yes. I cannot not talk about that as well, because I was equally surprised and impressed, because that's something.
No, it is definitely progress. And I think the work you're doing is amazing in terms of creating awareness and providing support to patients, and now informing policy as well. I think I came across a policy document by the Ministry of Health on patient support groups. I don't know if you guys had input on that.
We were part of the discussions at the time and earlier on. I don't know how far they've gotten, but we did give our input. Because one of the challenges that we keep seeing and need to address is that, yes, we are put in the non-communicable disease basket. And the rhetoric, not that it's not important, it's just that the rhetoric is about
the big five.
First of all, cardiovascular and all that, the big five, the hypertension and everything. So that's one, which is good. They're addressing that. And yes, a lot of people are facing those challenges, and people living with rare diseases also have that as a result of the primary diagnosis that you have. However, beyond that, most of it is about eating right, lifestyle diseases, being like making sure that you eat right. So when you come to the rare
it's prevention. That's the word you're looking for.
Yes, the word is prevention.
And it is a prevention.
There's a lot more about prevention. But with rare diseases, no matter how much good you eat, cannot prevent you.
Because some of it are genetic.
72% are genetic.
So by the time even being born,
you already have something, or you're predisposed to something. So there's no amount of eating right that can prevent you from getting a rare disease. It can manage, but possibly preventing, we are looking at other things. And so sometimes we are lost in that conversations, because when you come to our community, like, I ate right, I did all these things, yet my son has this. What did I do wrong? And so that also helps them understand in those conversations when they're talking about NCDs, is to just understand there's a whole other community you can easily forget when you're talking about giving these BP machines and all that, which is, again, very important.
What machine did you mention?
BP machines, like the ones for blood pressure machines. Blood pressure machines and sugar monitoring machines. Diabetes. What are they called? Diabetes, which is equally very important.
Yeah.
But there's a whole other community you could be missing out on, and they have their own set of challenges.
Yeah.
Yeah.
Okay.
And just to go beyond that, I just wanted to add about, and one of our objectives about improving the lives of people living with rare diseases. What else do we do? One, we do not have money to give. So most of the times we tell people we are very open to receive. However, one of the things that we do help is we find that you have conditions that have treatment that might not be a cure, but can keep you alive for longer. And sometimes those treatments are given for free, what they call compassionate use. And so most organizations will approach us looking for these people, or we know where you can get that treatment. So when you come and a patient comes or a family comes and they're looking for that, we know where to link them to. So we act like a hub of information, and sometimes even referral to doctors, because you find people coming, they are undiagnosed and they're wondering where to start. And we tell them, why don't you see a neurologist here? And most of the times the doctors that we work with in our network are open-minded to consider rare diseases, because that's another thing when we're talking about awareness, is bringing awareness to the healthcare providers to consider rare diseases in their diagnostic workup. That means that I am thinking, this looks like malaria, but if malaria has been tested like 5 times and it still looks like malaria, maybe you need to consider it could be something else. And the more than keeping this patient in a loop and giving them medication that doesn't work. Because we see that a lot. This patient is put in a loop instead of the doctor either referring to a colleague or to someone else, or move them up where they can get that information.
So what you see, so how I see it is that there's the role of the medical professionals, but there's also the patient's role or the caregiver's role.
Yes.
So what advice would you give the patient or their caregiver when you're looking for answers? Because sometimes it has to be a collaboration between both. We don't 100% depend on the doctor to find answers.
True.
But so then as a patient or as a caregiver of a patient, maybe the patient is a minor, what would you advise the patient? How do they approach their doctors to try and find solutions? Like you said, you've tested everything, you've tried everything. What should the patient do?
Okay. That's where patient advocacy comes in, and empowerment, whereby we tell our members that we are, let me talk on behalf of our parent, because I am one, we are their voice. If we don't speak up, we're not going to listen to them, listen for them. So, and with the patient empowerment, it's just basically believing in, because we are the ones who are going through that condition. We know this is where it hurts, where the shoe hurts, and even if it means documenting everything down and going to the doctor and saying, this is my research upon myself, this is what has happened, do that. Or worst case scenario, because I think we are way past that age of where the doctor knows it all and says everything, and that's a gospel truth. Now we should be part of the table. That's what we keep on saying. Patients are also part of the table, part of the diagnosis, the treatment, the care, the management. Because if I don't have a buy-in in what I'm being told, I won't even take that medicine. So it's just about basically literally discussing with a doctor. And if you find a doctor is too rigid, I'm sorry, get another doctor.
No, I totally agree that patients should be at the center of their care. Roselyn, you wanted to add something?
Sorry, I was just going to add that, and we always talk, when we talk to doctors, to understand that we are equal partners.
Yes.
And that sometimes some doctors don't like that. Equal in what way? It's to understand we all have our own roles. So if you're a parent, you know your child. You're the one who's going to give this medication to the child. You're the one who will take them to the next appointment. So you have a huge role that you're playing as a caregiver and as a parent. Then there's the doctor. They have the knowledge and all that. And so when we come to the table, it's not always one on top, the other one below.
It's not a competition.
It's not.
Exactly. Thank you. That's the word. It's not a competition. But together, we can help find a solution.
Exactly.
The doctor has many patients, different conditions to look at. I have all the time to read on Joubert syndrome. In fact, we've even set our comms in such that if whenever there's any news about Joubert in the world, we are the first ones to know the latest information, the latest papers that come out. I have that information. My doctor doesn't have that time. They have other patients. So when I bring that information, so understand, I have this info. I understand what's going on. I have the time. So together we can work together. It's not a competition. Together we all have our own different roles and we come to the table as equals.
Definitely.
As partners.
Yeah.
As partners.
Now, I just wanted to read something when Christine was talking about being a voice for the voiceless. I want to read how someone described what you guys do at RDK.
Oh, at RDK?
Yeah. I hope I can find it. So this is what I read online. Someone said, "You are the audible voice for the voiceless. You encourage others to take bold steps such as yours and to make the world a better place."
Oh.
So I think what you're doing is definitely being felt. You're providing support to patients and their caregivers, and also just the connections you've mentioned, that connecting them with doctors, or just what you're doing at the Ministry of Health, definitely making the world, especially for rare disease patients, better, right? So thank you for what you're doing.
Thank you.
I don't know if you have any parting shots before we wrap up.
Yes.
Yes.
If you are a patient or a caregiver being diagnosed today, please reach out to us.
And where can they find you?
Online on www.rarediseasekenya.org or telephone Safaricom 0701 025 753. But that aside, if you feel like, as well as tell our patients or our newly diagnosed members, we will help you through this journey. Worst case scenario, you'll find that you're not the only one walking through this journey. I think that means more than anything else. So please talk to us.
Roselyn?
So for me, it's to the undiagnosed and the general public. So first of all, to the undiagnosed. So if you're in a place where you're searching for answers, it might be rare, it might not be rare. You've been going through this journey that you find that you're still struggling getting a diagnosis for yourself or your child, still reach out. We will always refer you or find you a place that we can send you to, because we still cater for the undiagnosed who are still searching for answers and those who have gotten a diagnosis. So that's one. Two is to the general public. One of the challenges and major pain point for people living with rare diseases in the country is stigma. And stigma comes from the lack of knowledge. And how does it present itself? Where people think this family has 2 children like this, something went wrong. Either they didn't do something to God or blah, blah, blah.
They didn't give
That is
diary.
stigma. Isolating this family, not associating with them or seeing them in a certain way, it just adds to the burden.
Yeah.
And so if you have someone in the community like this, where especially you see several children or a condition that is not really known, this is not the time to point fingers and move away. Help. Sometimes help can be just sitting in and just listening to them, taking time to maybe even babysit for the mother to do something else.
Even to sleep.
Yeah, even to sleep or do something. This is not the time to try and cast aspersions about something, this or that, and further isolating them. More to that is that even if you know of a family like that, you can always refer them to us. They'll find a community that can understand and help them in this journey.
Yeah.
Thank you very much. Speaking of stigma, I've just remembered one more thing. When I started out in this advocacy journey, and I would speak to anybody and anyone who would listen. Even strangers, you know.
Oh, wow.
I would speak to strangers. And this is like soon after I'd lost my son. And I guess it was my way of dealing with the grief. I would speak to everybody and I'd speak at forums and, you know. And once a relative told me that, we don't like to be associated with disease.
Wow.
Yeah. I was told that. And can you believe I was not offended? Because
understood.
Our culture and the society we live in, there are some things which I was not offended, because where this relative is coming from, fine, they're happy with what you're doing, the advocacy and creating awareness, but don't shout too much about it because we don't want to be associated with disease. Even though it's genetic. This person doesn't know. We are part of the same family.
Yes.
It's genetic.
Wow.
Anyway, so that's about stigma. But like I said, I was not offended because I understand the society we live in, and the more awareness we create, then we eventually reduce the stigma. So let's not stop making the noise, keep talking, and then society will join us.
Yeah.
and reduce, and the stigma will reduce, right?
Yes.
Thank you very much.
Thank you for having us, actually.
Thank you.
It's been fun.
And I hope that whoever's listening, like Christine and Roselyn said, anyone with a rare condition or anyone in the medical field who'd be interested in learning more about rare conditions or just knowing the numbers. They said we have 105 conditions. If you're interested in research, feel free to reach out to RDK for data, from a data perspective. Thank you for tuning in to this episode of HealthPod Africa. I hope that you join me on the next one where we continue to discuss issues shaping healthcare in Africa. Please remember to subscribe so that you don't miss any of the upcoming episodes. The podcast is available on all streaming platforms. Thank you and see you on the next one. Bye.